Mandibular advancement devices are commonly referred to as stop snoring mouthpieces or mouth guards. As well as being used to restrict or totally stop snoring, they are often used to help treat those patients who are suffering from obstructive sleep apnea or OSA. In order to understand how these dental mouthpieces work, it's important to first understand a little bit about how they function, as well as to realise the relationship between snoring and sleep apnea disorders. Snoring and intermittent pauses in breathing are the most common symptoms of obstructive sleep apnea. It's important to note that in the case of central sleep apnea, the sufferer often does not snore and mandibular devices are not usually prescribed. So as your body relaxes while you sleep, so do the smooth muscles in your airway through which your lungs receive oxygen as you breathe. Unfortunately, in some individuals, these muscles drastically loosen to the point where the airway is blocked. The airway is a tube shape, a bit like a garden hose. However, unlike a garden hose that often holds its shape, in OSA sufferers this tube flattens out due to the lack of muscle tightness. With the airway collapsed, it then becomes difficult for air to pass into the lungs, and the muscles begin to vibrate against one another as their air passes through. This vibration is a sound that we commonly know as snoring. For many patients, this therefore begs the question, what does a mouth guard have to do with the airway in my throat? Any individual with a background in medicine or dentistry will tell you that the ear, mouth, nose and throat are inseparable when it comes to treating disease and disorder. A medical problem originating in the throat can show its effects elsewhere, and it often does. Mandibular advancement devices work by simply moving the lower jaw slightly forward. This artificial pushing on your jaw causes the muscles in your throat to tighten, lessening the obstruction in your airway, and this allows more space for the air to pass through to your lungs and dramatically decreases the likelihood that you will snore in your sleep. As a matter of fact, many individuals who simply snore, have not been diagnosed with obstructive sleep apnea, choose to purchase these mouthguards off the shelf as their primary concern is to stop snoring. They have full confidence in the product as it is fully endorsed by the NHS. There are many varieties of these devices available, and you should really consult your GP, who may prescribe you a mouthguard or recommend a manufacturer such as Sleep Pro, who manufacture a full range of products right here in the UK. These devices range from a simple standard mouthpiece to self-fit adjustable models, and the most sophisticated of all that are fully custom fitted especially for your jaw in their dental laboratories here in Britain. Many individuals are completely unaware that snoring is associated with any sort of sleep disorder. Fortunately, there is now a growing awareness of an obstructive sleep apnea, and many people searching for methods on how to stop snoring often discover after visiting their GP that their snoring is perhaps only a symptom of a wider problem and not just the disorder itself. So our advice is to talk to your doctor and let them check you out.